This is just a quick one. I'll probably post it pretty much straight out of the camera, but I read some news this week that a much beloved actor, the dude himself, Jeff Bridges, was sadly diagnosed with cancer. He posted a message on Twitter, and of course many people responded with support. And then I noticed a little exchange with Sulu, George Takei. I guess I prefix all actors by giving their most famous role, but anyway, saying that you're a fighter, you're going to beat this. And then a response from someone called Myrtle, which said, "I know you mean well, but please think twice about using terms like this. It's a form of toxic positivity that can hinder some. And cancer is not something that you fight, and those that died didn't do so because they didn't fight hard enough." So I wondered, does someone being a fighter suggest they're going to beat cancer? Is Myrtle correct in saying that it leads to the inference that people who lose their battle just didn't fight hard enough? And a lot of people disagreed with her, and there was a battle of a different kind in the comments about how to wish someone well after a diagnosis like this. Now, it's something that I've heard before, and you probably have too. Many cancer charities use terms like cancer warrior and fight back against cancer, and there's a lot written about this, so I don't want to go into it too much, but suffice to say that people are different. Some draw great strength from seeing themselves as a fighter, but others find that being told that they have to fight relentlessly is exhausting. And I can tell you that I've read some really tremendously powerful accounts from people with cancer who found the idea of fighting something that was inside them, and I've seen close family members lose their lives to cancer. And from my own observations, I do tend to agree that language is important. Ultimately, there's very little one can do to affect the outcome of an illness, especially something like cancer once it has already set in. There are psychological factors that affect health, of course, but the diagnosis of metastatic cancer, for example, once it's been made, having a positive mentality can be a coping mechanism, but it can't work miracles for the underlying diagnosis. Other language that we commonly encounter around disease is, later in the show we're going to have courageous and inspirational housewife Sally telling us why she's not letting cancer beat her, or talking about cancer journeys. And research into this has suggested people who are particularly focused on a battle metaphor might be more reluctant to accept the full gravity of their prognosis. Ed Yong wrote a wonderful piece this last week in The Atlantic about this obsession with being strong that we have when it comes to health. I really recommend you read it. If you don't already read Ed's writing, I don't know what to tell you. You're missing out on simply the best science writer around at the moment. So again, I won't go into that because I could only dream of writing such well-crafted prose as him, and you should read it. But I thought I'd supplement it with examples of the kind of language we use in medicine and how it can hurt patients. There are loads of archaic ones, often related to physical or intellectual disability, that are truly appalling and thankfully have been consigned to history. And then there are ones we use as kind of black humour that are definitely not formal terms. So what I'm concentrating on this video is ones that I have heard in fairly common use officially, that you may even find in the patient's notes. And I first thought of this when my wife was pregnant with our second son. At this point, my wife was older than a particular age cutoff, which varies in place to place, but in this case it was 34. Sorry, honey, I'm giving your secrets away here. And do you know what her pregnancy was classed as officially in her medical notes? A geriatric pregnancy. And this is a common accepted term, and in fact obstetrics is probably the worst offender for this kind of language. An absolute howler is incompetent cervix, which can lead to premature birth and indeed loss of a baby. It's a disorder of the cervix. But how insensitive is it to tell a woman that her incompetent cervix is the reason her baby has died? During our first pregnancy, my wife had failure to progress when labour ground to a halt and she needed assistance. Something that's often paired with this is poor maternal effort. Now, do you think that's a nice thing for a woman deep into labour, tired, maybe in pain, to hear that you've failed or you're just not trying? I'm yet to meet a woman that couldn't be bothered about whether her baby was born. Failure is a common theme in medicine. Heart failure is one of the most common chronic conditions, referring to a heart that beats less effectively than normal, and of course something I deal with on a daily basis as a heart doctor. And I'd never really given the title much thought until a few years ago when I encountered a hospital with a heart function clinic as opposed to the usual heart failure clinic, which they had deliberately named to avoid negative connotations caused by failure. Again, not wanting to suggest that this was some shortcoming on the part of the patient or their heart. And before you kind of wring your hands that this is snowflake thinking, remember that some patients with heart failure are running marathons, they're mothers of newborn babies, they're extreme athletes. It's a wide spectrum of disease, and their hearts are definitely not failing they're just slightly impaired. So it's factually wrong as well. Babies that aren't developing as normal are described as exhibiting failure to thrive. Another instance of failure is to do with treatment. The patient failed chemo is a common way of saying that chemotherapy wasn't successful, but I have heard this corrected many times by physicians immediately saying, no, it was chemo that failed the patient. We talk about compliance as well in medicine, that the patient wasn't compliant with their medication, they weren't compliant with their rehab program. This is a hangover from paternalistic days of medicine when patients were expected to comply with our plans, but it betrays a multitude of aspects about a patient's life that may not be taken into account. If they can't afford their medication, if they're caring for a loved one, if they're homeless, how can they be compliant? Moreover, no matter how much we disagree with someone's choices, they're in charge of their lives, not us. We can only advise them, but we can't command them. They are in charge of their own decisions. We talk about withdrawing care sometimes in terminal patients, but this is wrong. We care for them until they die. We may do is withdraw life-prolonging treatments, or some similar words like that. If you watched this channel before, you'll know I'm particularly interested in the language we use in healthcare from all sorts of perspectives, like the way we break bad news, the origin of words, the jargon we use, the way we label diseases and patients, and I'll probably make more videos on those. But what do you think about fighting disease? Is it a useful term or not? A very famous name in the history of medicine, Thomas Sydenham, first talked about fighting an enemy within in the 17th century, and this appears to be the origin of the kind of violent way we talk about disease. And over the years, especially with the advent of germ theory, military analogies became popular, being overrun by an invading army and deploying your troops in defense. If you find yourself talking to a friend or a relative who has been diagnosed with a disease, offer them your support, listen to them. It's going to be uncomfortable. That's okay, but try not to fill any awkward pauses with trite pleasantries, and just be honest. If you don't know what to say, then sometimes saying that is the best thing. Now, I'm supposed to be doing some disease fighting of my own by exercising, and I'm getting pretty cold. It's raining reasonably hard now, so I better get on with it. But if I ever have to deal with a diagnosis like that of my own, then I can only hope I embody the dude's famous words.
Can't be worried about that shit. Life goes on, man.
The beautiful beaches of industrial East London. Probably the best looking beaches on earth.
Yeah, well, that's just like your opinion, man.